a safe platform where everybody can be comfortable to talk about this topic of mental health. Hi guys, welcome to my YouTube channel. My name is Wanjiru Kabuchi and I'm so passionate about mental health. Now, the reason why I'm so passionate about this topic is because in modern society today, this topic is highly neglected. It is associated with a lot of stigma, is associated with a lot of prejudice, and also affected by a lot of stereotyping. Now, I want to create a good platform and I want to create a safe platform where everybody can be comfortable to talk about this topic of mental health. As you can see today, I'm privileged to have a guest. She's going to talk all about mental health and she's going to talk about this topic with a lot of insight because she's in this medical field and she's also dealing with mental health. So please introduce yourself.
Hi guys, my name is Hilda Wangogo, a clinical psychologist by profession.
Yes, I told you guys that today we are privileged to have a psychologist in the house and she's going to talk about this topic of mental health. Now, she's a better position of answering so much of your questions and many of the questions that we might be having when it comes to mental health. Directly, I'm going to ask her specific questions that deal with mental health. Now, Hilda, what is mental health medically?
Medically, mental health encompasses emotionally, physically, and psychologically that influence the perception and the well-being of a human understanding.
Oh, so it affects psychologically, it can also affect mentally, and it also go to an extent of, and behavioral, and it also go to an extent of affecting physically. Now, what is the societal perspective? What is the society's perspective when it comes to mental health?
When it comes to mental health, people out here think that those who are affected to an extent of getting to the streets, those who are mentally ill, tunasemanga in quotes ni wenda wazimu, they are the ones who are affected by mental health. But that's not the case.
So what is the case?
The case is we are all suffering from one thing or the other. And when we talk about mental health, as I mentioned earlier, people think that those who've broken down are the mentally challenged. But the fact is, we are going through a number of stressors.
Okay.
In our environments, at our jobs, in our relationships,
true,
back at home, within ourselves, in the churches that we go to. Stressors are all around. So before we know, nasikianga mtu akisema I'm depressed, and they don't even know what depression feels or means. They are stressed out to an extent of they cannot perform at work, they cannot function at home. That is mental health. So
when we group mental health, then we can say that there is that group, the group that is affected by mental health. It's quite a wide group of people who are affected by mental health. So mental health can affect kids, can affect the youth,
the
adults. Yes, I think that it is good that we get this from your perspective. What are some of the symptoms that anybody can first of all identify so that they can say, yeah, I could be suffering somewhere?
Okay. We have a number of symptoms when we come to mental health, and these symptoms varies from one diagnosis to the other. For example, an individual who is going through depression may present different symptoms comparing to someone who is going through stress, who is going through post-traumatic stress disorder, who is going through bipolar. We have different symptoms. But we have a number of symptoms that we check when it comes to checking whether this individual is scoring. There's how we score an individual, whether they score depression, stress, or bipolar, or those other illnesses that I've mentioned. And some of these symptoms are irritability. When you identify that, you are easily irritable, which is not usual with you. Unajipata tu unakasirika kidogo over little things that were not irritating you. And then we have the second one, which we call insomnia. Ama kukosa usingizi. You find that before ulikuwa unalala vizuri. Normally we sleep 6 to 8 hours. But unapata usingizi na uko 2, unakosa usingizi, or you oversleep. You can you can oversleep or undersleep.
Oh.
Yes. The other one is on appetite. You can overfeed. Kuna watu stress eat. So if you're out there and these days your patterns of eating have changed, unapata unakula every time una bite. That can be one symptoms that you're presenting, that you're going through stress. And then there are individuals who don't eat, like totally.
Wow.
And as the whole day, they are not hungry and they've not eaten. Before you know, you started losing weight. And now people out there can notice that
something is wrong.
To you.
Good. Now, as an individual, peke yangu hivi venye niko, what are some of the things that can contribute to my mental health breakdown?
There are a number of them. And one of the things that I usually say and I usually tell our clients, we are different. For example, if I would take myself, an employee somewhere, I'm a daughter, I'm a wife, I'm a mother, I'm a boss at home because I have a nanny, I'm all rounded.
Yeah. What a lot is expected of you.
What I mean is, I have a lot that surrounds me.
Yeah, true.
Nikienda kazini, I'm supposed to perform.
Yeah.
Nikirudi nyumbani, I'm a mother, I'm a boss.
Yes.
Yeah. But probably at work I'm not functioning very well. Or maybe I'm at an environment that is toxic. That may cause stress. Maybe the work that I'm doing, they need me to perform, and the resources maybe that they are giving, they're not matching with what they want.
Yes.
That can bring about stress at work. Again, tukienda nyumbani, tumesema I'm a mother, I'm a boss. Right now things are very different.
Very tough.
Yes, and things are tough.
Yeah.
So nikifika nyumbani, maybe finances are not enough. Nikirudi nyumbani, I need to be a wife who was stressed at work. Hawa ni watoto.
Nani?
Huyu ni msichana.
Ndio.
So niko na stress za kazini, niko na stress za nyumbani, si ndio? Tukifika
saying that one of the symptoms that I can notice is it's loss of appetite, or maybe I'm overfeeding.
Yes.
So you're saying that loss of appetite or overfeeding is one of the symptoms that you should be on the lookout if you are to notice whether you are suffering mentally.
Yes. And one of the things that I'll mention is we are all different. Our systems are different. So there are individuals who overfeed, there are individuals who don't feed, but it doesn't mean just because you're overfeeding or underfeeding, you are stressed out.
Oh yeah.
Could be you are ill.
Yeah.
But overfeeding or not feeding is one of the symptoms of mental illness.
Yeah. But I think I would take it where you're not doing your best meals, because there's some things that you like, there's some things that I like, and all of a sudden if I'm stressed out, I'll find no pleasure cooking that, so I'll just eat for the sake of eating, or I just feed for the sake of feeding. So I think when it comes to mental health, I think it's mostly on what do you like, what do I like, because if there's changes in that habit of what you like and what I like, I think it can be a trigger to you noticing that something could be wrong. Right?
We are all different, and we have different tastes when it comes to food. But what we are mentioning here is the change of pattern.
Yeah.
On how you're feeding. Could be you take breakfast, you take lunch, and you take normal dinner.
Yeah.
But upate, you no longer take breakfast, you no longer take lunch, before you know it's evening.
Yeah.
Na jioni ikifika, you're not hungry.
Oh.
That means something. Because normally you were feeding, but you're no longer feeding.
Oh.
Ama, there's a certain way you were taking your meals, but right now you're overfeeding.
Yeah.
That usually.
Okay. Good. The next one.
We have isolation. Isolation is the other symptom.
Oh.
Whereby, again, we are different. Kuna watu over socially, na kuna watu who are not very social.
Yeah.
But it doesn't mean hawezi toka huko nje wa engage na watu that they are familiar with. But when it comes to mental health, you realize you get to an extent whereby an individual is isolating from the society probably because of what has happened to them. Maybe they are sacked from their job, and people out there want healed out that was normal before they lost their job.
Okay, yeah.
People out there want a Wanjiru who is normal before they lost their marriage.
Yeah.
But things are totally different right now. So the society out there, of course, kuna questioning.
Yeah.
The time I lose my loved one, the time I lose my job, kuna a lot of questioning out there.
Yeah.
So what will I do?
Okay.
I will isolate myself from the society to run away from the questions that are asked out there.
Okay.
So one of the things that you would identify to a person who is going through something is isolating. Ile anajiwithdraw kama ni kwa functions za nyumbani they no longer attend. Kama ni kwa kanisa, you know these days people are very judgmental.
Yeah.
Sitaki kwenda kwa kanisa tena.
Yeah.
I did something and I'm being judged out there.
Yeah.
So unapata an individual has isolated.
Yeah.
And then we have the next symptom which is suicidal ideations or attempts. When we talk about ideation, is whereby you have ideas on how to commit suicide. And some of the things that we encounter with our patients, they already have plans.
Managed, well laid out plans.
Yes. They already have plans on how they commit that act, where and time. Unapata if an individual is suicidal, unapata maybe they have plans to hang themselves, so they already have a law. Kama ni an individual who wants to commit suicide through maybe intoxicating themselves, if I would use that word you see, dawa, they already have a plan to either overdose using maybe a prescription that they've been given from the doctor, or maybe a prescription that they bought themselves. Those are ideas. Kama ni kujidrown, they already know where, mto gani, na lini, hivyo. And then we have those who attempt. Kama ni kujinyonga, anajaribu kujihang, but they were rescued. Maybe mtu akawapata before the act was done. Kama ni hiyo kujirusha kwa mto, wana attempt, but they were rescued. Yes.
Okay, so you're saying that when it comes to suicidal thoughts, you can have premeditated suicidal thoughts.
Yes.
Whereby
you know when before it gets to that point, there's a number of symptoms, including feeling hopelessness, whereby you feel umefika mwisho, nothing is left. Unafika mahali you feel worthless, ni nini ingine umebakisha? There's nothing
that is working for you.
The only thing that this individual is thinking of is committing suicide. So they've given up with life, and the only thing that is left is for them to go or to commit suicide waondoke. So unapata this individual, they keep thinking about committing suicide. They've not attempted, but they are thinking about committing suicide. Why? Juu wamechoka. Kama ni marriage imewachokesha. And you're a witness. Yeah. We are having that on media every day since 2020 came. I think so. A young couple maybe amejinyonga ama amekunywa dawa because of the marriage that they're into.
They failed.
Maybe ako employed mahali kazini, lose a bunch of cash. And the only thing you can imagine right now losing 5M.
Yeah, I know.
There's a happy 5 million. We are on and we face stressors different.
Yeah.
Again, that is the other thing that I usually tell our clients. We face stressors different. When you handle losing that 5 million from your employer, would be totally different with how I would take that.
Yeah.
Mimi pangu ufanye your 5 million in the entire life.
Yeah.
But to you would be like, sintakuwa nakatwa maybe this amount of money mpaka nimalize.
Okay.
So that is what leads to the suicidal ideations, attempts, all that.
So medically, if someone has come to the hospital and this person had tried to commit suicide and maybe they were rescued, so the thoughts or the plans they were not executed as they would have done. So what are some of the measures that you do medically to go through, to take this person through, this process?
We have different categories of patients, and we deal with our patients both outpatient and inpatient.
Okay. So you can be admitted because of mental health?
Yeah, yes.
Okay.
Yes. Actually, a number of patients who are inpatient, 80% of them are mentally ill, not even physically. but they come in with what we call asymptomatic illness, whereby they have headaches, they have stomach aches, they have backaches that are not making any sense when it comes medically. Medically, it's not making sense. But when you sit down with these individuals, try to navigate on what they are going through in their daily life, socially, spiritually, back at home, economically. Kumbe hii headache ni Johanna kazi.
Backlog of so much stress.
And they cannot even sleep. What happens if you don't get enough sleep? You get fatigued, you're not productive for the following day. So before you know, you have backlogs of sleep, na hata huwezi lala. It is presenting as headache. So ukikuja pale unatafutwa kila kitu hakuna. But ukikaa chini kumbe na identify, you are going through a stressor at home, you are going through a stressor at work.
So as a psychologist, you have identified this person is suffering mentally. What are some of the sessions that you're going to take through the person?
So to answer your question that you had asked earlier, when we receive a client as an outpatient, what we do is to try and assess these patients. We assess them and classify them depending on the symptoms that they have to come up with a diagnosis. Yes. So we screen this patient. We do something called history taking. We take their history.
Yes.
From their biodata to their family history, socially, at work, every history that would interest you to know me. From there, we will come up with a diagnosis, which may be stress, depression, loss and grief, bipolar. Yes.
Okay.
All those symptoms. So after screening, we will know whether this patient is severely ill.
Okay.
Ama ako moderate, ama ako at risk.
Okay.
For example, a client who is suffering from depression. Kuna client anaweza kuja akiwa at a low risk. They are not sleeping, they are not feeding, they are isolating, and they are not interested in some of the activities that they used to do, like gymming maybe, or walking, or maybe going to work and all that. That patient usually do is to do psychotherapy, or what a number of people out here know as sessions. The counseling
Sessions. Yeah, we have had them.
Yes, we sit down with them, we talk with them, we try to identify the stresses that they are going through, and then we work with this client to get a solution. Remember, at the end of the day, it's not about you, the therapist. It's about you, the client who came. So before you even came, you knew what you want with your life. Lakini ile tu anataka tu kushua tu kidogo na kusupport that support. That patient tutamwonea outpatient. Again, we have a patient who is at a high risk. This patient, we put them as inpatients
for sessions.
Yes.
Now, this person has started the sessions. Do they finally come to a realization that they were doing something to, like self-harm? The moment they come to the hospital, maybe they had tried self-harm. Now they have gone through these sessions. Do they go back and realize themselves, and then how do they move forward?
Of course they do. So some of them do, some of them don't. Especially those that have reached helplessness and worthlessness. They just want to go. But I would say majority of them do. And the reason as to why we put them for inpatients, especially those who are at a high risk, is to combine medication and therapy. Because a number of them, you would come across a patient who is presenting some other symptoms when sasa wame go beyond the moderate. When you are moderate, we've scored for whatever symptom that we are not even seeing. After we've scored this patient, and they score either depression, substance abuse, and all that, those clients who are at a high risk, we put them into the wards. And we work in collaboration with a psychiatrist for medication. Tutapata wengine, they are beyond therapy peke yake.
Okay.
Because some of them get hallucinations. Hallucination is whereby they see images, ama they hear voices, ama wanasikia kama vitu zinatambaa on their skin, and they can easily harm themselves. Some of them have nightmares, and they are given medication.
Kutembea usiku.
Yes, the nightmares, the bad dreams, all that. They are given medication by the psychiatrist, and then on our side we do the therapy.
Okay.
So how I can explain it to get it, it's like today I go taking alcohol. Nikunywe pombe, si ndio? Just because I lost my job. What happens? Nikunywe pombe, nitakuwa tipsy, and then nitaenda nikiwa nimelala. And at that moment I forget that I've lost my job. But pombe sitashuka. Kesho nitaamka. Is the job there?
No.
The job is not there. So taking medication without therapy ni kama to run away from what is happening, block what is happening. Because if I got depressed out of losing my job, the job is not yet there. I'm depressed. Ndio. Nitakunywa madawa zenye zitafanya at least ni function, nilale, niweze kukula, but the stressor is not there.
It's still there. The stressor is still there.
The stressor is losing the job. That is still there. But kama imefikia mahali I'm suicidal, I'm hallucinating, I'm having nightmares, siezi lala, na napewa medication. At least medication will help me survive. But the stressor is still there. What I'm doing is emphasizing on the importance of therapy.
So people should accept. Now when they come to the hospital, they should accept to go through. Because I've heard people who are saying, Missy Zienda, therapy za mental and all that, Missy, sijakuwa mgonjwa. And you see now mental health, people, it's not a physical disease that you can say that ako hivi. So it's more of mental. So I think also in the process of the healing process also deals with, you have to accept, go for the sessions, take the drugs as prescribed and all that. Right?
True. Now, one of the things that I would tell people out there is to start with embracing mental health.
Okay.
The same way you get a headache and go to the nearest chemist and take that paracetamol is the same way that we should embrace mental health. We should embrace that there are stresses all around. Kazini kuna stress, nyumbani kuna stress, and again people should stop this stigma of mental health. Because the moment I've lost my marriage, I'm in fear of who to approach,
and what the society will say.
And what the society will say.
Of course.
So people should embrace mental health, that is one. And then two, wakubali. Kama haiko. Kama kazi imeisha. Kama relationship imeisha. Kama if they've lost something, they've lost. Let them face the fear that they have.
Okay. When it comes to mental health. So I think it's good. You have really opened up our mind in terms of, knowing the symptoms of mental health. What we need to actually do when we go to the hospital, we should not shy away. That's what I've gotten. We should not shy away from accepting that we are going through some stress.
The same way you come, the same way you come to a hospital with diarrhea.
Oh yeah.
You can imagine. But something like that, always shy off to go to the doctor and explain to them, or maybe a sexual transmitted illness. People go to hospital. But when it comes to mental health, you are depressed, you go to an extent of breaking down just because you don't want to face that stigma.
But you see, the society, I think has presented itself in a very judgmental manner. Now, if today you lose your job, you are used to supporting your family, you're used to supporting your siblings and all that, and you lose that job, they will not understand that you need now a time to change that kind of a lifestyle. If you lose your marriage, hey, another story. That one we will come for that. So I think now, as much as we are accepting, it's good now to look at the extent of which it is going to affect you mentally. First of all, accept the situation that is at hand, then accept yourself and
take time to heal.
Take time to heal.
Self-time to heal.
But I think when it comes to mental health, I think even when you go to the hospitals, there is no word that is written psychologist ward, psychiatrist ward. I think the hospitals that I've visited, I've never seen that.
They are there.
Uh-huh.
They are there.
Uh-huh.
Because one of the things that you want to do is to create an awareness.
Okay.
For people to come out.
Mhm.
You're a witness. So many people are committing suicide.
Really?
So many people are depressed.
Very many.
But they are
Not having help. They
Yeah.
do not even know how to seek help from the word go. And actually majority, today I'm just surprised that a psychologist deal with more of mental health. You know, people usually associate mental health with psychiatrists. Now, what is the difference between a psychologist and a psychiatrist? Where do they come in terms of
a psychiatrist medicates.
Okay.
A psychologist
Mhm.
offers therapy.
Oh.
Yes.
So
But
this
in
process
most of the time,
Uh-huh.
we work in collaboration with
the-
the psychiatrist.
Yeah, so the two work in collaboration because you have to give the medication, that the psychiatrist will give the medication. Then you as the psychologist will come and give the session.
Yeah.
That is, the process of the healing process. Uh-huh.
Though not to all patients,
Uh-huh.
you don't have to be medicated just because you have stress.
Oh,
It depends with the severity.
oh,
Ikifika wakati you're depressed,
Mhm.
you have suicidal ideations, you're not sleeping, you're not eating,
Mhm.
you spend most of the time crying excessively.
Mhm.
Kulia ni therapy
Mhm.
because some of we
Mhm.
deal
Some of
with
us.
stressors. Yes.
Yes.
We deal with stressors
Mhm.
na kulia
Mhm.
to break down.
Yeah.
Na una feel you are okay, you
Yeah.
relaxed.
Yeah.
You felt relieved.
Yeah.
Sindio?
Mhm.
But ikifika ni ile excessively, it's a problem.
Oh. Now, when it comes to this topic, I think you have really opened up our minds, and I would wish that we continue with these sessions and talking more about this mental health because it's an issue in our modern society. Which will be your parting shot for today?
Today, when it comes to you, don't shy out.
Mhm.
One, it's okay not to be okay.
Mhm.
And one of the things that I've mentioned, we are all individuals who are surrounded by a number of things.
Mhm.
So when stressors come along, just speak up.
Mhm.
And it doesn't have to be until you get sick, you get hospitalized,
Mhm.
you require a psychiatrist or a psychologist.
Mhm.
A number of tips can work for you
Mhm.
because we are very different.
Yeah.
I talking to Wanjiru
Mhm.
can be a reliever
Yeah.
na nipate a solution from
From
her.
her. Yeah.
You breaking down is okay. We say that is therapy.
Yeah.
But kama ni excessively,
Mhm.
look for support.
Mhm.
Now, one of the things that I usually say, look for a positive support.
Okay.
We have a number of support,
Yeah.
but some support are not helpful.
Mhm.
Some support are there to see you break down,
Yeah.
see you hang
Scatter.
yourself.
Mhm.
Yeah, so look for a positive support system.
Okay.
A support system that understands what you're going through,
Yeah.
and a support system that will support you
Mhm.
until you get to accepting whatever that has happened.
Mhm. Okay. Thank you so much, Hilda, for coming to our channel, and thank you so much for your insight. And we look forward to more sessions and creating more awareness when it comes to this topic of mental health. Thank you so much.
Karibuni sana.